Welcome everyone to Stabilization, the first phase of trauma treatment workshop. My name is Shamsa Iqbal. I'm the presenter today. If I can ask you first to mute the microphone on your phone as well as your computers so that we don't hear you, that would be wonderful. I don't know what So today's presentation is about an hour long, and at the end there will be a question and answer period. So if any questions come up for you while I'm presenting, then please hold on to them, and then at the end we will have the opportunity for the question and answer period. Now, there are two objectives of this workshop. The first one is to discuss the role and goals of stabilization in trauma, and the second is to understand key components of stabilization. So basically, we will be looking at what is stabilization, what does it take to stabilize a child or a youth, and how can we do that. So I would like to start by asking you to imagine a sprinter with an injured leg. In order to help this person walk again, we would do different things. Firstly, we would provide them a cane or a crutch to walk with. Then we would help them strengthen their muscles through physiotherapy, etc., etc. And once they have gained enough strength, and when it is safe to do so, only then we would ask them to run again, right? We would not expect them to run with a broken leg, would we? If we did, then we would do more harm than good. In the case of a sprinter with a broken leg, we can see the injury because it is physical injury. Physical injuries are visible. However, there are some kinds of injuries which are not visible to the eye. These kinds of injuries are psychological injuries. We cannot see psychological injuries. Trauma causes psychological injuries. Psychological injuries affect our ability to cope with day-to-day stressful situations which are not even related to the traumatic experiences. Traumatic memories are the most scary memories for our trauma. Asking traumatized clients to work through their traumatic memories early on in therapy is similar to asking the sprinter with the broken leg to run when he or she cannot even stand. For people to go in their trauma memories, they need to first go in their body. And for traumatized people, body is a scary place to be in. When they go into their trauma, their bodies begin to relive it. So the most important job of a therapist is to avoid re-triggering clients. Our job is to help them regulate their affect. So it is important that we teach people techniques which they can use to calm themselves down so that their minds become available for learning and for processing things. Making people work through trauma memories when they do not have the skills to calm themselves down can recreate trauma-like situations. In that, they might feel as if the trauma is happening all over again. It can trigger flashbacks or trauma memories. Talking about trauma is often a scary thing for many people that we work with. People can't talk about their trauma. When they do, they become speechless and dumbfounded. Etobicoke, I'm sure you're all familiar with this name. He's a very big name in the field of trauma. He defines trauma as speechless horror. That's what he calls trauma. And this is so true because research tells us that trauma affects our cognitive capacity, which means that traumatized people are often not in the cognitive parts of their brain, which is the thinking part of the brain. And these would be our frontal lobes. And frontal lobes play a large role in speech and language, memory, planning, impulse control, decision-making, etc., etc. Traumatized people live more in their limbic brains because it's the limbic brain whose job is to prepare us to take action to protect ourselves from any threatening or dangerous situation. Amygdala, which is a part of the limbic brain, acts like a smoke detector to warn the body and brain that you are under threat. This is how it works even in a non-traumatized brain. But in a traumatized brain, the amygdala begins to misinterpret information, thereby sending wrong signals that there is threat when there is none. And the result is the fight, flight, or freeze response from many of our clients. Traumatized people see everything through the lens of their trauma experiences, and they interpret things as dangerous when they're not even dangerous. A good understanding of how trauma affects our brain is essential in order to help children and youth stabilize or recover from the effects of trauma. Our autonomic nervous system, it comprises of two parts, the sympathetic nervous system and the parasympathetic nervous system. Sympathetic nervous system helps to regulate the arousal response. You know, when people get aroused, either too hyper-aroused or hypo-aroused, and that happens when they are facing a stressful or a threatening or challenging kind of a situation. Sympathetic nervous system increases its activity as needed during times of stress. And sympathetic nervous system prepares us to meet the challenge and potential threat that any new challenge creates. Whereas the parasympathetic nervous system induces relaxation. It helps the body compensate for periods of high arousal. It provides a feeling of contentment and pleasure. So parasympathetic nervous system basically is the dominant function when we are quiet, relaxed, or asleep. And sympathetic nervous system and parasympathetic nervous system, they're both designed to function in a way that maintains a balance. So when one is activated, the other is suppressed. The problem is that in traumatized clients, the sympathetic nervous system stays activated for longer periods of time, thereby continuously releasing stress hormones in the bloodstream. The more the sympathetic nervous system stays active, the less active the parasympathetic nervous system would be. So trauma therapy is about teaching our clients to activate their parasympathetic nervous system when they are faced with stressful situations. We know that brain learns and grows in response to experience. When experiences are mostly stressful, then the brain gets wired to respond to threat. The result is a disorganized brain. So it is our job to help clients reorganize their brains. It is also our job to help them feel safe. So we need to make sure that we do our work in a safe, ethical, and effective way. Now, I'm not trying to say that people should be discouraged from talking about their trauma memories. What I'm trying to say is that it is our job as therapists or clinicians to make sure that trauma memories are not too activated. Because when they're too activated, the clients can be re-traumatized. There's always a risk of that. We must make sure that the clients have the tools which they can use to relax or calm down whenever they feel overwhelmed because of their trauma memories, thoughts, or flashbacks. Now, this is again about sympathetic nervous system and our parasympathetic nervous system, what they do. So as I had said earlier, sympathetic nervous system, it gets activated in times of stress. And so it's like a gas pedal. So it just prepares us to take action to protect ourselves, and it means good because it wants to protect us. So when sympathetic nervous system gets activated, our blood pressure increases, our pupils dilate, our muscles tense up, our breathing becomes heavy, stress hormones are released in the body. And whereas when the parasympathetic nervous system that is activated, then we feel more relaxed. The body releases relaxation hormones, our muscles relax, our breathing is normal, and our blood pressure decreases too. Now, what you see on the screen is the roadmap for trauma treatment. And in 1997, it was Judith Herman. She's a psychiatrist in the United States. She introduced the concept of three-phase approach to trauma treatment. Her model provides a roadmap for trauma treatment. And in this roadmap, the first stage is establishing safety and stabilization. The second stage is processing of trauma memories. And the final task involves redefining oneself in the context of meaning relationships, which means that the person learns to redefine themselves, and the trauma becomes integrated into their life story, and trauma is no more the defining story of their lives. So today, there is consensus among researchers and trauma experts that establishing safety and stabilization is the first stage of trauma treatment, and that it is the most important stage as it builds the foundation for the rest of the trauma work. The first phase of trauma treatment is the preparation phase, in which we help children and youth build skills to regulate or soothe difficult emotions. And trauma therapy begins with helping them manage everyday life stressors, which are not even associated with trauma. This is what trauma does. When trauma happens, people are not even able to deal with the normal day-to-day life anxieties or stressful situations. So once children and youth learn to deal with the stressors, everyday life stressors, they're better able to face the more scary trauma memories. Now, this preparation phase is called stabilization. This is the most important phase of trauma therapy. The skills learned during this phase prove to be helpful in other or more advanced phases of therapy. So, spend as much time as it takes to help your clients feel safe and in control of themselves. In other words, help them stabilize. And it is important to first establish safety and stabilization because this is the safe, ethical, and effective way of working with traumatized children and youth. When clients prematurely process trauma memories, there is a risk of clients becoming dysregulated or re-traumatized. And we don't want to do that. Now let's look at the goals of stabilization. So the first goal is establishing a sense of safety. The work of stabilization begins right from session 1. It begins with first establishing safety for clients and making sure their basic needs are met. This is very important. And this is the first and most crucial step in stabilizing clients, making sure they are safe and making sure that their basic needs are met. The body is a scary place to inhibit for traumatized people, and I think I've already said that. Trauma actually cuts off your relationship to your body. In trauma, the feedback from the body to the brain is poor. Trauma therapy is about helping clients to gradually learn to be in their bodies. So it is absolutely important that people first feel safe to go in their bodies, and they can only do this when they feel safe physically, which means that they are no longer in an unsafe situation. We should only begin trauma therapy when clients are living in a safe environment with safe caregivers or a caregiver. What is equally important is that they experience us as safe people. Our therapy rooms or offices should be a safe space for them, and they should experience us as safe people. Now, the other goals of stabilization are to help clients improve their self-regulation and to improve attachment relationships. These two go hand in hand. Trauma hits the regulatory systems of your brain and body. An important goal is to teach self-regulation skills. However, it would be difficult to achieve this goal unless we strengthen the bond between children and their caregivers. Why? Because traumatized children have limited capacity to self-regulate. Parents or caregivers are critical in helping children co-regulate their emotions. And what does co-regulation mean? Co-regulation means how parents or caregivers communicate with their children or youth, the language they use, and the way they respond to their difficult emotions, how they play with their children, how they model good coping and express their emotions, how they interpret their child's behavior and set limits. Children need help from adults to make sense of how they feel, in understanding why they're feeling the way they do, and in figuring out what they can do about it. Then other goals of stabilization include empowering the client, which is like eliciting client strengths and resilience, and also reducing any risks and developing safety plans around those risks. So another important goal is to empower clients. It is important to draw out or highlight clients' strengths and protective factors. And what are protective factors? Protective factors are the positive influences that can improve the lives of individuals. It is equally important to take note of risk factors. Risk factors are the negative influences in the lives of individuals. So the sequel of complex trauma, it includes affect dysregulation, attention or concentration issues, negative self-image. That's quite common among people who have been traumatized, impulse control issues, aggression or risk-taking behavior. So keeping all of these in mind, stabilization begins with first establishing safety for the clients. And part of establishing safety is also about reducing any risks that may that exist. Like, if there are clients who are cutting themselves or who are suicidal, then it's important to create safety plans around that. And it's important to ensure that clients' basic needs are met, because we cannot expect clients to focus or think about anything else if their basic needs of food and shelter and things like that, if their basic needs have not been met. So it's very, very important. They cannot stabilize unless we make sure that their basic needs are met. Then acknowledging their strengths and building up on them is absolutely important. And then also acknowledging and validating clients' strengths. We'll talk more about that in just a few minutes. And then, of course, helping them build skills to manage stress, anxiety, fear, etc., etc. Okay, so moving along. What is safety? We've been talking about it. It's important to establish safety. But what is it really? So safety is the extent to which the child is free from fear and secure from physical or psychological harm within their social and physical environment. Safety is the #1 priority when treating traumatized children. Trauma processing cannot be effective if the child continues to experience traumatic events. So in addition to being physically safe, the child must also feel safe. And in order to process traumatic memories, the child must focus on the inside. And a child can only do that when there is no perceived threat from outside. In an unsafe environment, a child will only focus on the outside, which is the people or world around him or her, which may elicit fight, flight, freeze responses, or the need to dissociate. So, therapy should only begin when a client is in a safe place, free from harm and in the care of adults who are caring and nurturing. If we are not safe or feel safe, we cannot focus on other needs. And when we don't feel safe, the parts of our brain in charge of survival take over. We go back in our limbic brains. And we don't access parts of our brain that have to do with learning and higher order thinking. And that would be our cognitive parts of our brain. Assessment of safety is an ongoing process in therapy. It's not a one-time thing. We need to assess for safety throughout the course of therapy. So we need to assess for safe living situation and safety in relationship. So some questions to keep in mind are these relationships, which means the relationships that the child has with their caregiver or the people in their lives, are these relationships potential sources of protection or danger? Does the client have appropriate supervision? Are the client's basic needs being met? What is the caregiver's capacity to meet the child's needs? And there are a few questions you can actually ask your clients too. So you can ask your clients questions like these. Tell me about who is in your family. How do people get along in your family? And ask specifically about each person in the family. Like, how does mommy get along with daddy? Or how does daddy get along with mom? And then, what happens in your family when someone gets in trouble? All these questions will bring up information that would tell you if the client is in a safe situation or not. And you can ask them, what is your biggest worry? What worries you? And then you can ask them, who do they go to when they need help? Things like that. So it's important to assess safety throughout the course of treatment. Now, there are different types of safety. So there are 4 elements in regards to safety: physical safety, behavioral control, emotional safety, and therapeutic safety. Physical safety means that the abuse has stopped. So in addition, the child is with a safe adult, and an adult who is able to manage the child's behavior. An adult who puts the child to bed on time, enables him or her to go to school, and makes sure that he or she will come to therapy regularly is important. All of these create safety for the child. And then it's also important to have adults who have sufficient authority and control over the behavior of the child. This also creates a sense of safety for the child, which means that these are the adults who are able to set limits, they're able to set rules, and they're then able to, and set reasonable rules, and then they are able to enforce these rules as well. This also means that these are the adults who can contain their emotions when a child gets dysregulated, and that they can help a child contain his or her emotions. Very important that the caregiver should be able to do that. And then there's emotional safety, which means that the child has an attachment figure that offers continuity in their relationship. Lack of an attachment figure can affect children's motivation to process trauma memories. Without a consistent and available attachment figure, the child can be overwhelmed by emotions and symptoms can worsen. So this attachment figure is one of the key elements in treatment. Then is therapeutic safety. We as therapists or clinicians must provide a safe therapeutic environment to our clients. And we will talk about it in a few minutes, that how we can go about doing that. I cannot emphasize enough the importance of attachment relationships in helping children or youth stabilize. Insecure relationships cause trauma. So as part of trauma therapy, we need to do something about the insecurity of that relationship with the caregiver that the child has. Attachment relationships can help a child stabilize. We can educate parents about the impact of trauma on child. we can help them understand their child's behavior through the trauma lens. We can help them understand that routine, consistency, and predictability create a sense of safety. Caregivers can help their child stabilize by providing a safe, stable, and predictable environment that includes keeping a regular schedule or routine for meal times, bedtime, playtime, quiet time, etc., etc. Trusting relationships create safety on a daily basis. Social connection, compassion, acceptance, support, understanding, all of these are the conditions which promote health and development. Social connection, compassion, acceptance, support, and understanding, all of these can be provided in each interaction with a child or youth. Caregivers can provide this, and we can also provide it to our clients. And it's important to remember that many of, especially youth that we work with, sometimes they don't have, they're not able to identify any attachment figures in their lives. So it's important that we become their secondary attachment figures. We can provide that to them through compassion and through acceptance and support and understanding and connection. So, being able to feel safe with other people is the single most important aspect of mental health. This is how important secure attachment figures are for children and youth. And safety is the foundation of all therapeutic work. The primary goal in initial phase of therapy is for clients to develop a relationship with therapist or a clinician in which he or she feels safe and trusted, and that he or she would not be rejected. Empathy and power are crucial aspects of first stage of therapy, and that's what we need to show to our clients. How do we establish a secure base in therapy? So there are 5 ways by which we can do this. So first, it's important that we make sure that the client experience our office spaces or us as safe people. So we need to make sure that client's privacy is protected. And we also need to make sure the therapy is spaced appropriately and has the right focus. And then trustworthiness is very, very important. It's important that we should not assume that the clients have the basic ability to trust. Our clients have been hurt by the people who should have been trustworthy, but they were not. So they are incapable of differentiating who is trustworthy and who is not. So therapy could be client's first stage setting. This relationship, the client-therapist relationship, allows the client to begin to trust and to learn to manage feelings within a window of tolerance and to build skills that were previously unattainable without such support. So very, very important. Then it's also important to give our clients choice. Therapy should include as much choice as possible. Abusive people and situations deprive victims of choice and control. For traumatized clients, fight or flight was not a choice, as they could not escape or fight off the abuse. So it's absolutely important that we provide choice as much as possible, and that we present as very collaborative in our sessions with our clients. Collaborative client-therapist relationship is a new phenomenon for many of these children and youth. It can be a shock for the client that the therapist is not there to tell them what to think, what to do, or how to feel. Then empowerment also creates safety. And the therapeutic relationship is the kindergarten for an empowered self. So that's how important it is. Children and youth with complex trauma, they present with challenging behaviors. It's always good to remember that. And I'm sure we have all had clients where we have experienced very, very challenging behaviors. I don't think it's something new would be new to anyone who works with children and youth with trauma issues. Connection, compassion, and empathy are very powerful things. These are the best gifts which we can give to these children, because these gifts help them change their behavior. So show a lot of compassion to these children and youth. Tolerate any negativity they show. Be mindful that they have been hurt by the very people who were supposed to protect them. They have experienced adults as unsafe and untrustworthy. So remember, it takes time to develop trust. Don't take it personally when they present as defiant, critical, or opposition. Take a non-defensive stance. Be curious instead, and maintain playfulness. It always helps. So we had also earlier said that it's important to meet clients' basic needs. So creating safety, meeting clients' basic needs also helps stabilize them. And children acquire non-caring attitude and feelings of hopelessness when their basic needs are not met. And they can internalize behaviors, or they can externalize behaviors. And internalizing behaviors include depression or somatic complaints like headaches or stomach aches or other kind of physical health problems, suicidal thoughts. Externalizing behaviors, they include aggression or defiance towards authority and self-harm, and they could present as suicidal too. Okay. Now, symptoms of trauma often dissipate when their basic needs are met, when they begin to eat well and they begin to sleep well, and when they begin to feel safe within the predictable routine of the home or treatment facility, which means that their safety needs are being met. So basic needs are met, safety needs are met, and that they are in the care of people or family or friends who can provide support and who have trusting relationships with you. So even these three factors, if those are present in a child or youth's life, they would help them stabilize, and often the symptoms of trauma dissipate when basic needs are met, when the safety needs are met, and when the social needs are met. Okay, and then as we had said earlier, in order to help children and youth stabilize, it's important that we reduce any risks which exist in their lives. And what are some of the things which can create risk? So depressive symptoms, self-harming behaviors, and suicidal thoughts must be managed before the processing of trauma memories can be introduced into treatment. Very, very important. Therefore, safety and stabilization focused activities are the first line and ongoing interventions throughout treatment. So it's important to understand risk, which includes an exploration of previous suicidal behavior and other known risk factors, and which include mental health issues. Are they using any substances? Are there any substance abuse issues? And then lack of supportive caregivers. Also, it is important to focus on protective factors and see who can provide support to the children and youth that we are working with. Gather input from all possible sources: doctors, teachers, psychiatrists, psychologists, parents, caregivers that are involved in their lives, and also gather information around protective factors as well as risk factors. Work in collaboration with children and youth and their families, very, very important, and work from a strengths-based perspective. And when it's important to develop safety plans, so I'm not going to go into detail of what are the different things which should be on the safety plan, but I will just give you a brief synopsis of it. So when you develop safety plans, it's important to develop safety plans for children and youth who present with self-harming behaviors and suicidal thoughts. And it's important that we actively involve young people in the development of a safety plan. And it's important that we explore the context within which these behaviors occur, and we identify the triggers. What triggers these behaviors? So it's important to create a list of that in collaboration with the child or youth. And then it's important to recognize the important role of parents or caregivers and other community members in establishing and maintaining safety plans. So we would ask clients that are there any other professionals who they could go to for support? Do they have a psychiatrist? Do they have a psychologist? Could they go and speak to their guidance counselor or a teacher or maybe someone in their church? So it's important when you're creating those safety plans to come up with a list of those people who can provide support. Of course, parents, caregivers, extended family members, friends, you would include all of those in the safety plan too. Share the safety plan with the parents and or caregivers and other significant others who can support the young person. Because remember that we are not going to be with the child after or youth after they leave our offices, but all of these people that they identify likely would be there to support them. And then teach parents or caregivers to provide validation and support and educate them about keeping the home safe. Teach coping skills and distracting strategies that the young person can use as part of the safety plan. Also, here in Toronto, we would give them numbers for the Kids Help-On and the Toronto Distress Center, Youth Mobile Crisis teams. We would also ask them to call 911, if it's absolutely essential to get help when the situation becomes unsafe. And also in the safety plan, it's important to include strategies for restricting access to potential suicide methods or means. So this was just briefly about developing safety plans. Now, so what comes to mind when we think of trauma? Our minds automatically think symptoms and risks. When we think of trauma, we often think in terms of problem behaviors, emotional concerns, deficits, and functional difficulties. One of the goals of a trauma assessment is to assess for symptoms as well as risks. However, a comprehensive trauma assessment also takes into consideration a client's strengths or protective factors. It's very, very important. So when we do trauma work, it is important that we take a strengths-focused approach. Because deficits-based view is a one-sided view. There's always another side to the picture. And it's important for us to keep that in mind. So work with the belief that all people have strengths. Traumatized people have strengths. Competency is what makes people feel good about themselves. Competency is a great protector against trauma, and people need to take pleasure in their talents. So it's very important. So it's important that we attend to the whole person. It's important to assess clients' internal strengths. Also, it's important to assess clients' relationship with family, with friends, with school, with community, and society. And it's important to assess clients' internal strengths, which include things like self-esteem, self-efficacy, intelligence, communication skills, outlook, problem-solving skills, emotional regulation skills, impulse control. So some questions to consider are, is the client able to be a friend and able to form positive relationships? Are they capable of doing that? What is the client's relationship with family, peers, community, and society? it's important to consider questions like these. These are just a few examples. People have inbuilt self-healing capacities, and our job is to activate them. All people have a reservoir of strengths, some of which have been tapped, and others of which have been left unexplored and unrecognized. It is our job to help them tap into their own strengths. An individual who has been exposed to stressful life events, but who is able to function well and achieve positive outcomes despite the adversity, is a resilient person. It means they have the capacity to bounce back, and most people do. So it's important that we attend to the whole person and not just their symptoms. In trauma work, finding a client's strengths may not be easy because the strengths can get obscured by symptoms. We can help clients uncover strengths at different levels. So you see a whole list of strengths in different areas, but this is not an exhaustive list. These are just a few examples. It could be much more than this. So biological strengths would be things such as, do they get enough rest? Are they eating well? If they're on any medication, then are they complying with medication? Are they in good general health? Do they exercise? Do they get leisure time, and how do they use it? Then psychological strengths, under that, there could be two different kinds of strengths, cognitive strengths and emotional strengths. And cognitive strengths are strengths such as ability to think and reason, intelligence, problem-solving skills, decision-making skills. And so when you're talking to them, and even when you're getting to know them, take note of these moments when they describe, when they give you examples, because they always come up with things, and they always talk about, clients always do. They have many different examples of how they have been able to problem solve or have been to think and get out of a difficult situation. Then also take note of their emotional strengths. Do they have optimism? Do they have coping skills? What coping skills do they already have? What have they already used to deal with it? Their distress or anxiety or fears. Then do they have self-control? Then about their social strengths. Do they have family and friends and mentors who could support them? Then also be mindful of their relational strengths, which would be their ability to form meaningful relationships with others, and ability to communicate with others in a meaningful way, and a capacity to nurture others. Do they show compassion, cooperation, and tolerance, and forgiveness, and empathy? Those are important relational strengths. Cultural strengths are very important too. What are their beliefs? What are their values? What are their traditions? Do they have a sense of community? Do they have a sense of belonging to their culture or community, or are there any problems there? Then educational strengths. Do they attend school on a regular basis? What are subjects they're good in? Are there any teachers who are supportive? Are there any friends or peers they get along with? What are their academic achievements? And what has gone well for them in school? And then our survival strengths, which are resilience strengths or critical survival skills. What did they do to survive their difficult experiences? Because we all have the natural tendency to do something when we are in distress. So our clients have also done that. It's important to explore that. And then are the community strengths. Do they have social supports and resources in their community? And do they have the ability to make use of social supports and community strengths? So these are just a few examples of many different kinds of strengths and different areas of strength that we can tap into. And it is important for us to use a strengths-based approach. And so a few questions you can ask to tap into your client's strengths are, You can ask questions like these. How have you managed to survive? What helps you deal with what you have experienced? What else have you experienced that was difficult? What helped you then? Which of the things which helped you then could be useful to you now? How can you comfort yourself? Who else can comfort you, even only if a little bit? These questions help clients to find examples from their own life. This tells the clients that they have overcome adversities in the past and that they can overcome them now, even now. Such an approach empowers clients, especially when it comes from them and not from us. We simply help them uncover their own strengths. Similarly, you can ask them, what have you tried that has been helpful, even if a little bit? How do you ensure the situation isn't worse than it is? How do you do that? Which personal strengths and resources do you use? How do you succeed in getting from one moment to the next? This question is very helpful, especially with those clients who present with suicidal thoughts. Another question that I usually ask my clients is, those who present with suicidal ideation, what is your motivation to live on a scale of 1 to 10, instead of asking the other way around, where 10 is you're extremely motivated and 1 or 0 is where the motivation is really, really low. It just makes them think otherwise. So we want to actually make them think, like, what are their reasons to live instead of why they do not want to hurt themselves. Also ask questions to elicit responses which speak to the resiliency of the child or youth. Strengths-focused therapists believe that people who have been exposed to stressful life events are able to function well and achieve positive outcomes despite the adversity. Resilient people achieve positive outcomes while being confronted with adversity. So a few other questions that you can ask are, for example, what helped you survive your difficult childhood? Or what helped you survive your difficult experiences? What have you learned from these difficult experiences? So an important job of therapy is to open up people to different parts of themselves. That's one of our jobs is. Okay, so far we have looked at establishing, stabilizing clients by establishing safety, making sure their basic needs are met, making sure that they have attuned caregivers, caregivers with whom they can enjoy trusting relationships, and also that there are no risks. If there are, then we have safety plans to make sure that to stabilize them. And then of course we need to tap into their strengths, and it's important that we help them build up on those strengths because they already have it in them. So our job is just to help them uncover those strengths. And then of course there's skill building parts in stabilization, and there are different kinds of techniques we can use. There are verbal techniques, there are nonverbal techniques, and there are a combination of both which can be used. And with the help of verbal and nonverbal techniques, the frontal lobes, which is the cognitive part of the brain, and the limbic part of the brain, they begin to talk again. Because in traumatized children and youth, there's a disconnect between these two parts of the brain. They don't talk to each other when a child is in distress or when they're overwhelmed with anxiety and fear. Okay. So in terms of some of the verbal techniques, one of them is psychoeducation. So you can provide psychoeducation to the client and to their caregivers. And even teachers, like, I've done that. I've gone in schools and I've talked to principals and teachers and helped them understand a job behavior. So you can provide it to actually many different people involved in a child or youth's life. It always helps. So the use of psychoeducation has two purposes at this stage of treatment. Number one, it teaches the client about the symptoms, how to recognize them, how to anticipate them, what they mean, how to manage them. And two, it decreases the client's shame, confusion, and sense of being crazy. So a significant factor in stabilization is the gradual redefining of the client's role from that of victim to that of survivor. And with the help of psychoeducation, we can do that. We want to convey to clients that all of these symptoms make perfect sense as a response to traumatic experiences. So, and by doing this, we not only de-shame the survivor, but we also empower them. And so we draw the picture, by doing this, we draw the picture of someone who is smart, who's creative, who's resourceful, and who's in control of themselves and their feelings. So each and every troubling symptom can be reframed with the appropriate psychoeducational input. For example, suicidal impulses can be reinterpreted as, so these are your attempts to, this is what you can say to your client. So these are your attempts to cope with feeling trapped, helpless, and out of control in the face of overwhelming emotions. Cutting or other types of self-injury could be interpreted as, so the sight of blood or physical pain or injury can trigger an adrenaline response, which produces a calming and alerting effect. So maybe that's what it's doing for you. But at the same time, it's very, very important that we tell the clients that this is a short-term method which doesn't work in the long term, and in the long term, it has negative consequences. It's important to explain that as well. Hypervigilance becomes, you learned to stand guard over yourself because no one was there to protect you. Mistrust and paranoia becomes, you learned that it was safer to assume the worst in people than to assume the best. Self-loathing becomes, you found a way to protect your family or to feel you had some control by blaming yourself. So during the stabilization phase, any and all kinds of psychoeducational input is useful because it helps the client to make sense of his or her overwhelming feelings and behavior. Now, the skill building. This is not an exhaustive list. I just have a few things here which I'd like to discuss with you, but there are many other things that you can use in terms of helping your clients build skills to soothe themselves or to relax themselves or calm themselves down. Container and calm place. These exercises are useful in the beginning of treatment. These provide safe and healthy distraction from stressful situations. You begin with least stressful situations and help the client work their way up to the most scary memories. And container, this could be used at the end of your meeting or your session with the client. So you can ask them to place all of their worries or fears before they leave your office in a worry box or in a container where they can leave all their fears or negative feelings and emotions. Just so that, and it stays in your office so that they don't need to take it with them to their office. And it's always good to end your meetings or your sessions with your clients on a positive note so that they leave feeling good and not feeling stressed. Then container exercises can also be applied with grounding. And grounding is an experiential technique which allows the client to remain in a present state as opposed to a dissociated one. So teaching youth how to ground themselves when they begin to dissociate can be helpful in keeping them safe. And simple ways to encourage grounding include asking the client to describe a picture in the room, 5 things he or she sees or hears, or the texture of the chair in which he or she is sitting. And then there's tactile grounding exercises, which include asking the client to feel his feet on the ground, his or her feet on the ground. You can ask them to squeeze a pillow or grasp the arms of the chair. The idea is to bring the client back in the present moment. And some children and youth enjoy having their own grounding objects, such as smooth rocks or textured toys, etc., etc. Then resource development. I've always found this as very helpful in the beginning stages of my work, and so in resource development, you invite the client to think of a situation or experience in which they were able to demonstrate the quality which they most desire to have. Like, for example, some clients say, I'm so weak and I'd like to feel powerful, I would like to feel courageous, or I'd like to have my wise self, I would want to feel strong again or confident again, things like that. So, so the idea is to help the client use these resources to learn to recognize the sensations in their body and the associated feelings, the feelings associated with their sensations. One important thing I'd like to mention here is that many of our clients cannot differentiate between sensations and feelings and thoughts. They don't know. So it's always because, most often they don't even have the vocabulary for feelings and sensations and thoughts. They cannot differentiate, and they confuse one with the other. So it's important to help them differentiate by doing certain exercises. You can even have a whole list of sensations, a whole list of feelings, a whole list of thoughts, just so that, when you're asking them to, what sensations came up for you when you think of this place or this experience or situation where you were able to demonstrate that desired quality of, let's say, where you were able to demonstrate some confidence. So what sensations came up for you and what feelings? And if you have that list in front of you, you can actually ask the client to, which one of these do you feel in your body right now, in this moment? And you can do the same with the feelings. So with the help of these resources, the client learns to manage anxiety or arousal within a window of tolerance. And this is a really good way of empowering clients. This is a really good way of tapping into their strengths, because they begin to see that I already have it in me, that I can do it. And I'm not a broken person, and it's not that I'm not a crazy person. The very powerful exercises, really helpful. I don't have time today. I could have gone into more detail in terms of how exactly you do these exercises. Then breath is another one. So breath actually, it helps us calm down, but it should be used with caution, because it can trigger anxiety in some clients. Because some of our clients, when they were being abused, they held their breaths. And sometimes clients would tell you that, when I do the breathing exercises, it triggers me. So you can do it in many different ways, in creative ways. There are many different apps available to these days. That's the best part about technology these days. And many of our young people we work with, they're into, they are on their phones or iPads. And so you can even introduce those to your clients. If you go and check in the App Store, you'll find many of these. And some of them work really, really well with children and youth. Then yoga. It really works really well. So if your clients like doing moving meditations such as yoga, that would be wonderful. In yoga, the focus is on the out breath, because out breath stimulates our parasympathetic nervous system. So if you remember just a few minutes ago, we talked about it, parasympathetic nervous system, it induces relaxation and it calms us down. The in-breath, on the other hand, it activates the sympathetic nervous system. And sympathetic nervous system is the part of the nervous system which gets activated in times of stress because it prepares us to take action. So yoga, in yoga the focus is on out breath, and it stimulates our parasympathetic nervous system and it helps us to calm down. Dissociative symptoms, research tells us this, that dissociative symptoms resolve with yoga practice. And this is very true. Like I co-facilitate a group for female survivors of childhood sexual abuse, and in that group we use a lot of psychoeducation, we use mindfulness guided meditations, we use trauma-informed yoga as well, and by the 5th session, women who present with dissociative symptoms, they start reporting a reduction in their dissociative symptoms. They begin to report that they have now can feel a connection with their body. So they are now by the 5th session or so, they're able to be in their bodies, and the body is not such a scary place to be in. So the parts of their body where they had no sensation or where they were reporting numbness, they could feel sensations again, which is so beautiful, and this is so powerful. And it works really, really well with children and youth as well. And research, I think Bethel Vanderkolk and some other researchers at Trauma Center in Boston, Massachusetts, they did a research on yoga, and they saw amazing changes after 8 sessions with the people that they worked with or they did the research on. So yoga is really a good way of stabilizing clients. Now, yoga improves heart rate, it improves our balance, it improves muscle coordination, and these are the functions of our brainstem, the lowest, most primitive part of our brain. And earlier we had talked about that trauma disorganizes the brain. So how do we reorganize it? This is exactly how we reorganize it, that we reorganize our brainstem through things like, by modulating the heart rate and making sure the body, the balance, and muscle coordination, it helps. Mindfulness is another important way of stabilizing clients. And now, researchers tell us that mindfulness should only be used when people have self-compassion. If they don't have self-compassion to begin with, then maybe the mindfulness meditation, guided meditations that you can use with them are those which are the loving kindness meditations. Just because you want them to feel connected to themselves, you want them to be able to give love and kindness to themselves and to the world around them. And sometimes you can close off your meetings or a session with mindfulness meditations, and there are many different kinds of mindfulness meditations these days that you can find. Then movement, very important. I don't think it's here on the list, but absolutely critical, essential, very, very important. Why? Because traumatized people's bodies are stuck in frozen terror. So the way you hold your body determines to a large part how you feel. As long as you don't move, you cannot get better. Being involved in activities where there's flow in them, where things change in a usual way of useful way is a useful way of getting rid of the feelings of stuckness. Martial arts could be one of them, but really it could be really simple movement. So when you are in a meeting with your client or you are in a session, there are a few things you can do. You can actually, it's important to listen to the clients. Yes, absolutely important to what they're saying, but it is also important for us to observe how people breathe, their body movements, their facial color and expressions. So, for example, sometimes when I'm talking to young people, children or youth, and when I see that when they're talking about, some of their experiences, and if they're curling up in their chair, then I would say something like this, like, can we take a pause? Okay, tell me, what's happening in your body right now, and as you are in this posture? What do you feel in your body? What sensations? what do you notice? And then again, I would have that list of sensations and feelings, and I would let them identify. And clients would usually report, I feel, a heaviness in my chest, or I feel a burning in my stomach. These are, for example. And then I would ask them, so let's try something. Let's sit up straight, but make sure your shoulders are relaxed. And you sit up straight and you open up your shoulders. And take a deep breath, and or I would just let them breathe normally, and then I would ask them, tell me, how do you feel in your body now? What do you notice in your body? So, and then I let them take a few moments, and then usually clients report very positive sensations. Oh, I feel more confident. I feel like the whole space has opened up. I have opened up. I've heard words like these from my clients, which is really, really amazing and powerful. It's a beautiful thing to see in a session with young people. So then I would ask them, okay, so can you just come back in that position again for me, curl up again? So the client would curl up again and say, notice what happens. And then they would describe the sensations and the feelings for me again. And then I would ask them to go back up, again in that posture with the open shoulders. And then I would let them do it a few times so that they begin to notice the changes in their bodies. And that's the way to begin to teach them to be in their bodies in a very, very safe way, in a very, very playful way. I sometimes even ask them to, okay, why don't we take a break? Let's go take a drink of water and come back. So we would walk around, come back. So we're teaching them affect regulation skills. We're teaching them how to bring their stress levels down, especially once it has gone up. So things like that. So it's very, very important. Other things you can use is, which are of course not here on the list, are a sand tray. It's another interesting way of working with young children. Writing works really well. Journaling works really well with some children and youth. Art, of course, you can ask them to draw. You can ask them to create any scrapbooks, things like that. Very, very powerful techniques. So these are only a few techniques. That's all I have today to discuss with you. We're coming to an end of this, of this presentation today. So this is what comes to my mind. I'm a very visual person, a visual learner. And I see stabilization, this is how I see safety and basic needs being the foundation, and then strengthened, the safety plans being the pillars where we reduce risks and resilience. And of course, attuned caregivers need to be here too, and emotional regulation skills come when there are attuned caregivers in children's lives. So this is what it is. So that's all from me today, and if you have any questions, then I can answer them now.
Or not under. I don't know if we all really appreciate how much time we spend. And she said that's it.
There are no questions? I can drink water then. Okay. Still waiting for questions. Do we have any questions? No? I think that's it. Thank you very much, everyone, and bye for now.